Hi, everyone. Good morning. How's everybody feeling? Woo! Better than me, hopefully. All right. Well, so good morning, everybody. Welcome to our 2024 Leadership Conference. This is going to be such a fun weekend if it already hasn't been. Hold on, let me just fix something. All right, it is my honor to deliver my first opening address as our union's president. This is one of my favorite weekends of the year, one that we prepare for, recover from for a week or so, because I get to see so many familiar faces and meet the new leaders of our union. Stand up if this is your first leadership conference. Stand up. Woo! Welcome. Welcome. So my hope is that all of us will meet new people this weekend from different parts of California and Hawaii who we can't wait to see again at our leadership conference next year in LA. The most important thing we can do this weekend is to get to know each other. There's so much wisdom in this room. There's so much experience when it comes to fighting for what's right. And there are so many new ideas just waiting to be shared. Our conference is about building relationships, sharing our struggles and successes, and learning our craft so that we all leave here more determined and better equipped to fight for our coworkers and protect patients. As you'll see on Sunday, the NUHW Leadership Conference is also a newsworthy event. In keeping with tradition, we will host in this ballroom the first candidate forum in the race to become California's next governor. Seven years ago in Orange County, we welcomed the major candidates on stage at our leadership conference, and NUHW members voted to endorse Gavin Newsom. At 10 a.m. on Sunday morning, we'll have a panel of journalists asking questions of nearly all the announced candidates, including Lieutenant Governor Eleni Kounalakis, California Superintendent of Public Instruction Tony Thurmond, former State Senator Tony Atkins, and former State Controller Betty Yee. It's too early to make an official endorsement, but immediately after the forum, you can participate in our straw poll to indicate your preference for governor. And we'll share the results of the straw poll with news organizations. When the candidates take the stage, it's important that they see each and every one of us that's here right now. So no sleeping late, no leaving early. Everybody should be here by 9:30 a.m. and stay throughout the forum. You never get a second chance to make a first impression, and we want to show the next governor of California that we are a big, politically engaged union that is a force to be reckoned with. So we're not going to make news today, I think, maybe, but we're going to do a lot of important things. During our plenary session this morning, we'll review our progress toward empowering everyone here to take on more responsibility, like handling Weingarten meetings and new employee orientations. We know it's hard work, but it's important because the boss fears workers who don't have to rely on staff organizers to get results. We're also going to talk about what democracy means to us and what we can do as union leaders to protect it. Because the forces that are trying to undermine our rights as citizens are also trying to undermine our rights as working people. And then tonight, we're going to honor two of our favorite people. Sal Roselli, our NUHW President Emeritus, and Ralph Cornejo, who has worked alongside Sal longer Ralph Cornejo, who has worked alongside Sal longer than many of us have been alive. There's so much to do, but before we go any further, It is my pleasure to introduce Vanessa Ko, our new Secretary Treasurer. Vanessa understands what makes NUHW special and why it's so important that we win our toughest battles. As a teen, Vanessa's Kaiser therapist had a huge impact on their life, and Vanessa eventually became a unionized therapist as well. They volunteered during the early days of our union when we were fighting for our survival and came back to work full-time 9 years ago, empowering workers to one victory after another. We wouldn't be where we are today without Vanessa's dedication and commitment to this work. Thank you, Vanessa.
Good morning. Thank you, Sophia, for that. So now it's time to recognize our executive board members. We're going to have everyone come on stage. Come on up. Give it up for our e-board. All right, folks. So please say your name and where you work.
Kelly Shaner, Providence, Eureka, Humboldt.
Nicholas Cordero, Providence, St. Joseph, Eureka.
Mariela Cardenas, Cotton Good Rehab in Goodland.
Lucy Lamont, Keck, USC.
Jackie Shallett, Children's Hospital, Oakland.
Shay Loftus, Kaiser, Northern California.
Stephanie Lumho, We're Everywhere, Children's Hospital, Oakland.
Phil Florendo, Seton Medical Center, Daly City.
Alana Marcucci Morris, Oakland Adult Psychiatry in Kaiser IBHS.
Christy Reimer, Kaiser IBHS.
Erica Olden, Providence Cedar Sinai, Tarzana.
Lemore Fetterman, Kaiser IBHS.
Jacqueline Patrick, Children's Hospital, Oakland, California.
Elizabeth White, Kaiser, Southern California.
Pam Rude, retiree from Kaiser Psychiatry, San Diego.
Noemi Aguirre, Respiratory, USC, Keck.
Jim Clifford, San Diego, at the Mexico-Tijuana border. Bienvenidos a todos.
All right, thank you, everyone. Let's hear it for our NUHW Executive Board. So before we continue, I just want to note that 4 executive board members could not attend this weekend. Lisa Carroll and Jody Forder, who work at Kaiser, Porfirio Quintano, who works at Sutter CPMC, and Angie Woods, who works at Keck USC.
So this is NUHW's 15th anniversary. As one of the people who was around on day one, it's hard to convey how much we have accomplished together under incredible odds. We went from no members and no money to surpassing 19,000 members earlier this year with the biggest reserve we've ever had. We are defined by our values of being bottom-up and member-led. But there is a spirit that makes us who we are as NUHW. It's that spirit that led us to start a new union. It's that spirit that led us to lead the fight for mental health parity at a time when the subject was still taboo. It's that spirit that sustained a 10-week strike by therapists in Northern California and a 172-day strike by therapists in Hawaii. It's a spirit that comes from knowing there's no challenge in front of us that's bigger than what we've already overcome together.
Over the past year, NUHW members have shown the spirit and determination to win contracts that their employers never expected to offer. Nearly 400 workers at the Sutter Health Psychiatric Hospital in Sacramento and Sutter Home Care workers across Northern California joined our union recently looking for better pay and a bigger say in the care they provide. But what did Sutter do? Sutter decided that it wanted to force our new members to start paying for their health insurance premiums, just like it had gotten other unions to do. It took 2 strikes at the psych hospital, multiple pickets, and a lot of political support. But we won a contract that included strong raises and preserved the free health plan. Last year, good morning. So last year, nearly 30 workers at Rogers Behavioral Health in the Bay Area joined NUHW. Those 30 workers were all on the bargaining team. They rotated who would attend each session, spoke up for one another, and kept each other updated about what transpired. They were so united that management ended up rescinding proposals because our members warned, "We're gonna go on strike if you do this." And management knew they meant it. All right? What they won is a model for any future contract for behavioral health care workers. They won limits on caseloads. They won limits on how many, They won limits on how many newly admitted patients can be assigned to a therapist or a registered nurse. They won their first wage scale with additional annual raises. They won a provision that allows them to waive their no-strike clause if the employer seeks to change working conditions. That's not it, y'all. And they won the respect of workers at other Rogers facilities. Right after our members ratified their contract, Rogers workers in San Diego marched on the boss, and now they're NUHW members too.
So we won a lot of hard-fought contracts over the past year, several of which included strikes. Surprise! At Marin Health Medical Center, our members won 19% raises after holding a one-day strike and authorizing another one. At Kindred Bay Area, our members won 23% raises after a 3-day strike. At Seton Medical Center and Seton Coastside, our members held a 3-day strike earlier this year, and just this week, we not only won 16% raises over 3 years, we forced management to improve the fully employer-paid health plan and to dramatically reduce the cost of the PPO healthcare plan. Through the strength of our bargaining teams and determination of our members, we also won strong contracts at Santa Rita Jail, Hazel Hawkins Memorial Hospital, Stockton Unified School District, Mission Neighborhood Health Center, Dominican Hospital in Santa Cruz, Aspen Nursing Homes in and around Sacramento, San Rafael Healthcare and Wellness Center, and Novato Healthcare Center.
One of our advantages in being member-led is that union members have a lot of really good ideas. Workers know what they need to feel respected, feel protected, to best be able to do their jobs. We're not the biggest union, but we are leaders when it comes to winning benefits and protections that other unions haven't even started fighting for. We're one of the first unions to secure Juneteenth as a paid holiday. We're one of the first unions to reimagine bereavement leave to apply to people who are like family to us, even if they're not related. And we are one of the first unions, healthcare unions, to start securing contract language that protects workers against the unknown implications of artificial intelligence. The contract we mentioned at Rogers, back to y'all, it has a clause that reads, bargaining unit positions shall not be eliminated as a result of changes to technology or the introduction of new technology. We won the same protection at Sutter, and we're going to win it everywhere over the next few years.
When we say game on, it's definitely game on at Providence Health and at the University of Southern California's medical system. This is where we're growing the fastest, and this is where we have the opportunity in the weeks and months ahead to win contracts that set a new standard in our state. Over the last 6 years, we have doubled our membership at CAC USC to more than 2,200 workers at hospitals, clinics, labs, and a call center. Now we're all working together to win the best contract ever at USC, and we're ready to do whatever it takes to make that happen. The university started negotiations by demanding wage freezes and higher healthcare costs. They are slowly getting the message that the only thing they're going to get is a strike. Unless they provide fair raises that address severe staffing shortages. We've picketed, we've rallied, and if USC still doesn't think we're serious, they should count our strike authorization ballots. 87% of the main bargaining unit cast votes, and 99.2% voted yes.
Providence. Providence is one of the biggest hospital systems on the West Coast, but it's shrinking its services. In Northern California, over the last few years, Providence has closed 2 birthing centers, sold off its outpatient labs, laid off workers, and is now closing the only inpatient acute rehab facility in Humboldt County. And if you think that's bad, Google Providence and Charity Care. Providence has $8 billion in reserves, but it intentionally hounded patients who should have received free health care and instead forced them to pay their medical bills and sent them to collections when they didn't. We know we can beat Providence, and more workers are believing it too. Hundreds of unorganized Providence workers are voting yes to join our union and our coordinated bargaining council. Two years ago, our members in Tarzana won the best contract in the entire system, 40% raises over 4 years. Providence has a simple strategy to deal with this in Northern California: divide and conquer. They want to divide us by job classification, by insisting on separate contracts for our new professional members. They want to divide us geographically by insisting we negotiate separate contracts in Humboldt, Napa, and Sonoma counties. And what did our members say to that? Yeah, no thanks. Look, we have strength in numbers and we're using them. Our Providence members in Northern California voted to bargain together for a single contract that raises standards everywhere. And we're not taking no for an answer. If you want to see someone struggle to keep their cool, you should see Providence's attorneys when an NUHW member from Humboldt County drives 4 hours south for bargaining in Napa. Sometimes the attorneys yell when the visiting workers choose to speak. Sometimes they walk right out of the room. But every time they act that way, we know we're strong, right? When I say union, you say power. Union. Power. Union. Power. When I say union, you say power. Union. Power. Union. Power. That's right. We're strong, right? We're going to win a common standard-raising contract in Northern California, and we're going to win strong contracts for our Providence hospice and home care workers in Northern California, and our newest members at Providence San Pedro in Southern California.
So it's game on at Providence. It's game on at USC. And it is always game on at Kaiser Permanente. Kaiser behavioral health professionals have done such an incredible job holding Kaiser accountable that last October, the California Department of Managed Healthcare fined Kaiser $50 million. That's the largest fine in state history for violating mental health parity laws. State investigators found that Kaiser doesn't have enough caregivers to meet the needs of patients, doesn't monitor if patients are getting appropriate care, doesn't have enough inpatient psychiatric beds, doesn't use legally required criteria for determining if patients qualify for behavioral health care, and doesn't have a functioning grievance system to address complaints, including complaints filed after patients went to our website, kaiserdon'tdeny.org. So let me ask you, does anybody here think that Kaiser is really going to fix these problems? No? I do. You know why? Because we are going to make them. We have 2,400 members in Southern California who are ready to make Kaiser fix these problems, even if it means striking for as long as it takes. That includes medical social workers and licensed social workers. That includes psychiatric RNs and psychologists. And that includes caregivers who visit patients' homes. They're all going to do it because they're sick of being understaffed. They're sick of not having enough time in the day to finish their work. They're sick of Kaiser patients not getting the care that meets their needs. And they're sick of Kaiser treating them and their work as the lowest priority in the Kaiser system. After striking in 2022, Kaiser mental health therapists in Northern California now get 7 hours a week for critical patient care tasks that can't be done during therapy appointments. In Southern California, Kaiser therapists get as little as 2 hours for those tasks. And Kaiser provides pensions to virtually all of its employees except its behavioral health care professionals in Southern California. That's not right. And we're going to put an end to it because Kaiser can't reform its behavioral health care system until it stops shortchanging its patients and caregivers in Southern California.
Kaiser is the biggest violator of California mental health parity laws, but it's not the only reason why Californians struggle to access behavioral health care. Insurance companies offer lower reimbursement rates for mental health providers and put up so much red tape, many therapists give up and stop taking private insurance. The result is that many Californians are priced out of therapy. Fixing this won't be easy, but NUHW is taking a leading role through our Behavioral Health Associate Membership Program. BAM. Currently, there are more than 100 private practice therapists who choose to pay NUHW dues so we can take on the insurance industry together. It's not going to be quick or easy, but our goal is to build a legal framework for private practice therapists to bargain collectively for higher reimbursement rates so more Californians can afford behavioral health care.
We're going to talk a lot about politics, the state of our democracy, and the November election later this morning. We have a saying at NUHW that politics is union business. That has once again been the case over the past year. Our contract victory over Sutter was aided by key elected allies that had influence with the company. And 3 county boards of supervisors passed resolutions supporting the rights of our Kaiser members to have enough time to perform all of their patient care duties. In May, NUHW members converged on the state capitol during our annual lobby day and helped advance 2 important patient care bills that we were sponsoring. It was our biggest ever lobby day, but next year is going to be even bigger. And everyone will have a chance to sign up for it later this morning. The good news is last night, Governor Newsom signed our bill that will give the California Department of Managed Healthcare more tools to make health plans abide by access to care laws. However, that same agency, by submitting an inflated cost analysis, helped kill our other bill, which would have helped patients win grievances against their health plans. With a state budget on shaky ground, passing new bills won't be easy. But the more allies we can elect to office, the more power we wield, and the more we can accomplish.
Folks, we are growing. More than 1,000 healthcare workers have joined NUHW since our last conference. That includes nearly 600 workers at Providence Little Company of Mary Medical Center in San Pedro. And those folks just had their first ever informational picket. It includes more than 150 professionals at Providence's Santa Rosa Memorial and St. Joseph Eureka, who have seen Providence cut services and are ready to fight with their coworkers to protect local care. And it includes more than 30 nurses, social workers, home health aides, and therapists who provide home care for Providence and Sonoma County. If you're a Providence worker who just joined our union, stand up. It includes more than 400 workers at Keck USC facilities, including Verdugo Hills Hospital, the USC Spine Center, the Pasadena Lab, and the USC Engelman Student Health Center. Stand up. That's right. And it includes hospice workers for Southern Sacramento and San Mateo counties, and at Hospice East Bay here in the Bay Area. Hospice folks, stand up. We're getting bigger, we're getting stronger, and we've never had so many opportunities to make things better for each other and the communities we serve. Think about what we've done over the past year. After years of stagnation, we led the way in passing a bill into law, SB 770, that advances us on the road to Medicare for all in California. Through our strike and our patient empowerment efforts, we set the stage for California to impose the biggest mental health fine in state history on Kaiser and require Kaiser to transform its mental health delivery service. We stared down Sutter, the biggest hospital operator in Northern California, and kept our free health plans that other unions had already given up. We've won caseload limits, technology protections, things other unions aren't even fighting for yet. We've always been the underdog. We've always been underestimated. But what do? Time and time again, we punch above our weight. Now think about what we can win over the next 12 months. Do you think we can win the best ever contract at Keck USC? Do you think we can raise standards across the Providence system in Northern California and San Pedro? Do you think we can get UCSF Children's Hospital Oakland to fill its hundreds of vacant positions? Do you think we can make Kaiser Permanente start treating our professionals with the respect they deserve? And do you think we can talk to our friends, our relatives, and our neighbors about the importance of electing pro-worker candidates? Heck yes. Every one of us has earned the right to be here. We've worked so hard for so long to get to this point where there's so much opportunity. And the question is, are we going to take it? We're going to try that again. Are we going to take it? Are we going to fight through adversity for it? Are we going to support each other to make it happen? That's right, it's game on.
So before we begin the remainder of this year's plenary, there are a couple more things we need to do. One of Vanessa's duties as Secretary-Treasurer, which used to be mine, is to provide our annual financial report. So, let's give them a second to catch their breath, drink some water, go over our finances. No, you don't need it? Okay, all right, you got it.
Oh, thank you. All right, so last year our budget was $14.2 million. This year's budget is $18.5 million. Yep, that's a 17.5% increase. We now have 70 staff who cover organizing and representation work, research, communications, education and training, patient advocacy, politics, and operations. Yeah, give it up for our staff. Our continued growth in size and influence speaks to the bright future of NUHW. Here's how each dues dollar is spent. 61% goes to staff salaries, benefits, and payroll taxes. 1% goes directly to our strike fund. 18% goes to representation and organizing. 3% goes to legal and other professional fees. 6% goes to occupancy and operations. 8% goes to COPE for our political program, and 4% goes directly to our reserve fund. As of August 31st, our strike fund balance was $242,139, and our reserve fund had a balance of $1,132,617 at this time. We're doing well. So, this information is included in the State of the Union book. Also, I want to remind you that our store is available for you and all members to buy NUHW swag. Please check it out at the table in the hallway and on our website, nuhw.org.